Good evening, everyone. I appreciate you taking the time to join me for the mysteries of the thyroid. We're going to add some clarity, bring some vision to the thyroid, help you understand what the thyroid does, what are the things that impact the thyroid, and if you've heard about dysfunction with the thyroid, and maybe you've had a thought process from whether you've experienced it personally or talked to friends or family, and they've been on thyroid medication. I'm going to give you some ways to think beyond that tonight. I'm going to share with you exactly how the thyroid functions and the things that we can all do to easily optimize our thyroid function that really aren't that far beyond our reach. So I've been somewhat eagerly anticipating sharing this information with you because I think the perspective I'm going to bring to you tonight is fairly unique in that it's not commonly talked about, but it's very well founded in science, which I think all of us can appreciate. So I'm looking forward to sharing this information with you. As I get started here, I just want to say again, I just want to welcome everyone again to the presentation. I want to thank you for joining me. And for those of you that are with me that I've not had the opportunity to interact with or to meet on some level, let me just give you a real quick background on myself, just so you can have a bit of an understanding who you're interacting with. My name is Dr. Arland Hill. I have been in practice for roughly the last 2 decades now, about 20 years. I've been working in the functional medicine and clinical nutrition space. During that time, my primary focus has been in working with my clinic, which is Genesis Wellness, to help my patients deal with the root causes of their dysfunction and not chase down symptoms, but try to address all the facets that are affecting whatever dysfunction it is that they're bringing to me, and overall just clearly try to help them optimize their health. And then, and you'll see why I'm going to bring this up, it'll have relevance later in our presentation tonight, but I am also, along with my wife, the owner and operator of Harvest Hills Ranch. And again, you'll see why I bring that to the conversation, but we are a completely regenerative ranch. And when it comes to food production, we are in 100% avoidance of any chemicals and raising things, raising our animals, everything that we do with the intention of driving more nutrition into the food that we provide, not only to our customers, but that we partake of ourselves. So with that, I have a lot of material that I want to share with you tonight. So let's not belabor this anymore and let's get rolling right into this conversation. And so right out of the gate, I need us to all be on the same page and to have an understanding of the thyroid gland itself. We need to have some clarity about what we're talking about. I think most of us would know that the thyroid gland is located in the neck. You can actually, if you put your hand on your neck and touch lightly in there, you can feel it. It's going to be right in front of the trachea, or the windpipe, as sometimes we more commonly hear that called. But it's going to be just below the Adam's apple on the neck. And so that's right where it sits. And it has a bit of a butterfly shape to it, as you can see here. So there's a left lobe and a right lobe. We call the two different halves here. And just to help you have some context of the actual size on this, you can get a bit of a feel for it from the images here. But the thyroid gland only weighs about 2 ounces. So we're not talking about a huge piece of tissue here. It's fairly small. As I will share with you and show you examples of, it is fairly susceptible to outside disruptors from the environment. So we have to be very attuned to protecting it. But what is less visible from the illustrations that I have here is that the thyroid gland is made up of several small cells. These are, in thyroid terminology, these are what are known as follicles. These follicles, if you hear terms like T3 and T4, these are the main hormones that we produce from the thyroid gland. I say main hormones because these are truly, even at a clinical level, these are the only ones that we talk about. But there are other hormones that are part of this picture as well. But we're going to shelf those for the night because there's so much for us to talk about just with this T4 and this T3. Now, keep in mind that as we're talking about the thyroid gland, it is part of our overall endocrine system. And that's a bit of a fancy way of simply saying the hormonal system. But when you look at the overall hormonal system, we want to give appreciation to the complexity of this system and I like to call this a symphony nature or an orchestra nature. And what I mean by that is that all of the pieces of our hormonal system, and again, of which the thyroid gland is a component, all of these interrelate with each other. And if we see disruption on one of these glands as a part of this system, then we have to at least appreciate at some level there's going to be an impact on the other glands that are a part of this system. And this starts to affect things like our metabolism. And I'm going to add some detail to that word metabolism tonight, because I don't want you just to simply think about that as how fast I burn through calories. That's not a great way of thinking about metabolism. And unfortunately, that's a bit of how that word has become pigeonholed. So we don't want to do that, but hold on to that thought. I'm going to clarify that later. But these hormones, again, they're associated with our overall metabolic rate, the way we process things, the way we regenerate. They're linked to how when we're young, how we grow, but also how we develop and recover and heal. So if you think in terms of any tissue function throughout your body, not just for us guys thinking about the testes, or for women thinking about the ovaries, or the breast tissue, those are far too limiting in the thought process. We have to think all of the tissues of the body. So for example, the brain, the gastrointestinal tract, these tissues all are affected by hormones as well. And so when we think about, just to extend on that conversation a bit, when we think about the gastrointestinal tract, most people don't talk about the direct impact that the thyroid has on the GI tract, but those two are directly related with each other. In fact, if you do a bit of research, you'll start to find out that there is something called the gut thyroid axis. And we're not going to delve into that conversation tonight. I just need you to appreciate that exists. And it further exemplifies the impact that not just thyroid hormone has on literally all the tissues throughout the body, but all of the hormones have on all the tissues throughout the body. So again, we'll talk more about other hormones down the road, but I want to keep our attention focused on thyroid here. But think symphony, think orchestra. And the reason I use that analogy is that, when you listen to an orchestra play, they are so integrated and fine-tuned, and everybody is listening to everybody else's cues, and they just all work together, and it just creates a harmonious sound. But if one person in that group of many is off, which would seem insignificant, it changes. It's not as harmonious as it would be otherwise. And that's essentially the story of your hormones. Now, let's talk about iodine for a minute. And the reason I want to start with iodine is because right behind T4 and T3, these sometimes what are known as thyroxine and triiodothyronine, just a lot easier to say T4 and T3. We think about the T4 maybe as the inactive thyroid hormone is how it's a lot of times talked about, even though it does have some slight activity. And then we talk about T3 as our active hormone. But the next thing that comes into the conversation right behind those two is going to be iodine. And the reason that iodine is so important to this conversation is that, one, iodine is not something your body is going to make. Iodine is a micronutrient that has to be acquired through the diet. We're just not going to pull it in from anywhere else. So if we're not getting it through the diet, we have to at a very minimum supplement it. And when iodine is absorbed in from our food, it's taken in through our bowels, and ultimately it's going to go to a couple of key tissues throughout the body. And so, of course, thyroid being one of those. But ladies, listen up on this too, because it is also equally relevant to the breast tissue, and it also serves a role in estrogen metabolism. And so there is a relationship here in terms of how iodine influences not just the thyroid, but also because of this relationship that it has with the estrogen. There is a link between estrogen and thyroid. So if estrogen levels start climbing up, it pushes more into a hyperthyroid type of presentation. So we want to appreciate the role that nutrients like iodine play in the thyroid, but it's not solely related to the thyroid. It's a much bigger conversation than that. And the key consideration in this, if you will, is that nutrients like iodine are fairly, it's not, let me say this a different way. It's not uncommon to find these deficient in the population. These deficiencies are much more prolific than what we would maybe initially consider, or even what we've been told as far as how prolific these deficiencies are. So we do want to pay a lot of attention to this. Now, what does an iodine deficiency look like? Well, let's look through this list, and I'm not going to read the list here to you, but I do want to pick out a couple of points on this. So just think on that left column where you see sore and stiff joints in the morning. Just ask yourself, how many times have I woken up and started to try to move around in the morning and I felt achy, I felt stiff, I felt like I had to limber my body up before I could really hit the ground running and get out there and do the things that I need to do throughout the day. If you look on the right side here, you'll see the second bullet point, dry and cracked skin. For example, if you look on the elbows or the heels, the back of the heels, you may see that you have some dry and cracked skin. Those could be indications of an iodine deficiency. And so we want to take that into consideration, and we want to look at these clues that the body is giving back to us and say that may provide additional insight into what we can do to support the thyroid, as well as some of these other tissues out there where iodine is linked. Okay. Now, I did want to talk a bit more about T3 and T4, because again, these are the two main players in this thyroid conversation. And so your thyroxine is what's known as T4. So that those two are interchangeable. A lot of times you just hear this talked about as T4. And if you ever look at your lab test, if you're getting a lab test done, on the lab test, it tends to use both terms. So if you see thyroxine, that's your T4. And the reason it acquired that name is because there's 4 iodine atoms attached to that basic backbone of the thyroid hormone. So you have this basic backbone, and then you attach 4 iodine molecules to it. But in order for that molecule to have any significant impact on any cell throughout your body, it has to purge one of those iodine molecules. And that is how it acquires the name T3. And if we do an overall breakdown on this and we look at what the rough percentages on this are, you'll see here that roughly about 80% from the gland itself, we have about 80% of what is produced from the gland is going to be T4. And then in terms of, if you look at the activity, there is some T4 and T3 produced from the gland, but it's by far T4 is what's being produced, which brings up the question, and this goes back to this conversation of active versus inactive. If you think about most of the time, if any of you have had labs done and you had your thyroid, most of the time what is predominantly looked at is a TSH marker and a thyroxine or T4 marker. But that again is looking at an inactive thyroid hormone. So we can't solely depend on that. Good general starting point, but we need additional information to be able to make real decisions about what direction we need to support the thyroid here. A couple of other things that I want you to think about in this, if we look at how T4 and T3 regulate, especially how T3 regulates, if we're looking at things like heart rate or how fast our intestines process food, if we don't have adequate levels of T3 and also T4, we find that there is not going to be sufficient amounts of motility in the bowels. The heart rate may be slower than what it optimally should be. And if we see that there's too much thyroid hormone, then we can see the opposite. We may see that there's, for example, someone may swing from constipation to diarrhea. So there's too much stimulation, or the heart rate may get too fast. Sometimes we hear with low thyroid that there's weight loss, but if it were too much thyroid hormone, it would be the opposite. There's weight gain with too little thyroid hormone. But if there's too much thyroid hormone, it would be weight loss. And so these are things that we want to consider here. And so let me just real quickly interject. If any of you that have not had an opportunity to mute your microphone, please do, so we can have a good recording here so everybody can learn efficiently on this. Now, with that being said, let me take a look at what I think is really where the rubber starts to meet the road. And this rarely comes into the conversation, especially at the level that it should. And this is going to start to link this TSH marker that many of you have had assessed, and that is often used to start to guide the recommendations or interventions for low or high thyroid. And so with that being said, if we look at the pituitary gland and the hypothalamus, so these are located in the central portion of the brain, but these are what are going to control the thyroid gland. And so this is so important. These are brain-derived hormones that are truly the master overseers of the thyroid gland itself, and they dictate how much hormone level is produced. So when your thyroid hormone level drops, this hypothalamus region in the brain that's located at the base of the brain there, it starts secreting or starts telling the pituitary to secrete more of that TSH hormone that you see on the labs. And as a result of that, then your thyroid level starts to come up, because we just told your thyroid gland, hey, you're not being active enough. You need to kick it in gear and start producing more hormone. The opposite is also true. When we see too much thyroid hormone in the system, the brain reads that amount of thyroid hormone in the blood, and it tells the thyroid gland, don't be as active, don't produce as much hormone. You've already got a sufficient amount in the blood, and we need to make sure that you're not overstimulating and creating too much thyroid activity. So as you can very quickly see, just from this piece of the conversation, it would be almost impossible to efficiently regulate the thyroid function without giving some consideration to what the impact is coming in from the brain, coming in from the pituitary gland and the hypothalamus. Think about this just as an analogy to help you visualize it. Think about this as the thermostat in your house. And so if the pituitary and the brain are the thermostat, and it's reading the temperature, when that temperature drops below a certain level, the thermostat recognizes that and it tells it to kick the heater up, or vice versa if it's trying to regulate from cold. And so you understand the point that I'm saying is that we have to have a system within the brain that can efficiently read what the thyroid activity is. And so therefore, if we're not doing that and we're not nurturing the pituitary and the brain equally here, we're probably not fully impacting the thyroid as well as we would like to. And this, just to give you a different visual on this, it's somewhat of the same context of what I just shared with you there, but this is just a visual. This is how it all plays out. You'll see the thyroid gland, it produces that T4, T3, it cycles back up into the brain, and then the brain tells the gland, okay, this is how much more activity or less activity you need to have. Now, let's say that this system starts to go haywire. Let's say that things don't work as efficiently as they should. Maybe we get into a situation where there's too much activity from the thyroid. So we can simply look at that as an overactive thyroid type of case. This is what we would simply call hyperthyroidism. Now, fortunately, hyperthyroidism is nowhere near as common as hypothyroidism. So we're going to spend most of our time with hypo. But if you feel like, for example, if someone were having, believe it or not, fatigue can be associated with hyperthyroid as well. But if we see things like tremors or mood swings, anxiety, if the palpitations, right? If you feel your heart overly beating in your chest, profuse sweating, these are all things where the metabolic rate for the body has increased systemically. So multiple tissues have been affected by this increased metabolic rate, and we want to do things to dampen that and bring that back under control. And interestingly enough, many of the things that we're going to talk about on the underactive thyroid side here are also interventions for overactive thyroid or the hyperthyroid. Now, let's talk about this underactive thyroid, though. And this is just simply, we more commonly talk about this as hypothyroidism, which is where it can be, depending on how we define this. And this is an interesting point that I want to elaborate on a bit, because there's rarely a definition associated, or more of a category associated with hypothyroidism. Most of the time when we hear about hypothyroidism, everything in hypothyroidism is lumped into the same category. And that's not an accurate way of moving forward on this, because there can be a hypothyroid presentation that is brain-based. It can be thyroid-based, which would be the logical deduction many times, and which is often what is considered to be the problem. But that's not the only one, because again, it could be brain-based. So brain, thyroid. We could have a liver or kidney issue that's affecting our thyroid directly, or we could simply have an issue where our cells are no longer listening to thyroid hormone, even though the amount of thyroid hormone being produced is adequate. So we could be dealing with any of these tissues. So this is not just a thyroid issue that we're talking about here, even though the presentation is very similar. So what does the presentation actually look like that I'm referencing here? Well, notice some consistencies on this. We may see fatigue, and that's a very common one in this scenario. Weakness, just not able to regenerate the tissues as efficiently as we need to. If you look in the mirror, or look at your body and see what indicators the body's giving back to you, we may find things like dry or real coarse hair, if you will. The skin may have a dryness to it as well. It may feel rough or have a pale appearance. Hair loss. This is often one that females report back, is that they feel like they're losing a lot of hair. And then if you feel like, especially in a time of the year like we're in now, where it's starting to get cooler, we're in the cooler months of the year, if you just feel like I can't warm up, I'm staying cold all the time, that is a strong indication that your metabolic rate is not up where it needs to be. There's three others here that I want to point out to you as well. Constipation. So many times we might think, well, constipation's I don't have enough fiber in my diet. That's not many times what the issue is. Dumping more fiber into the diet, and some of you may have experienced this, many times in that scenario will actually make the situation worse. So that's a fairly strong indicator that it's something more than just a lack of fiber in the diet. Depression, when we see or we've interacted with individuals who have dealt with depression, maybe some of us have dealt with it ourselves. When you look at that, a lot of times that simply has to do with how much activity or lack thereof, better stated, that we're seeing from the brain. And that can be a byproduct of lack of stimulation from thyroid. And that also ties into the last symptom that I want to share with you, which is memory loss. So if we start to see those early indications where I don't remember where I sat down things, I can't recall names like I used to. I'm having a conversation with someone and I know what I want to say. It's right there on the tip of my tongue, but I just can't get it out. Those could all be early indications of low thyroid function. So keep that in mind. Now, what does this look like? I wanted to see some of the symptoms that I mentioned here as well, but I want you to, if you have some real interest in this, take a look at this picture. These are actually teeth marks in the lateral or outside portions of the tongue. So if that tongue sits full and heavy and it feels full in the mouth and it's starting to lay out against the teeth and you see these teeth marks there, that can be one of the body's indications that we're looking at hypothyroidism. Now, there's a couple of other conditions in this that I want to talk about, and then I'm going to start getting into what the function is and how we can start to do something about this dysfunction that I'm sharing with you here. Let me point out a few other areas or conditions about the thyroid that we should at least be aware of. So one, as this image illustrates here, which is going to be a goiter in the neck, that can be associated with some of these nutrient deficiencies. And a lot of times this can be one of those things that can be an early indicator. In fact, many practitioners, especially those more attuned to working with thyroid, this is one of the things that when they are palpating, touching the neck there, they are often trying to feel for a goiter. And many times you can, if these are caught early enough, we can start to see a reversal on these if they're manifesting. There's also a condition of what's known as thyroiditis. Itis, anything ending in itis, meaning inflammation. So we're talking about an inflammatory process of the thyroid here. Most of the time when we talk about these are going to be of an autoimmune nature, meaning that the immune system is starting to attack various aspects of the thyroid tissue. And the problem with that especially if it's allowed to play out for a long enough period of time, is that many of these cells of the thyroid, so I use that term follicular cells or follicles, if you will, those cells start to die. And if enough of those cells die, these are the hormone producing cells of the thyroid. If enough of those cells over time die, the thyroid is going to be dysfunctional because there's not going to be sufficient amounts of hormone that is able to be produced. And then the last thing is thyroid cancer. And truly the only thing for us to, at this in this conversation, to talk about related to this is that it can occur secondary to some of the other dysfunctions that I've been sharing along the way with you here. So if you're thinking, well, how proactive do I need to be on this? So what, I have fatigue. I can still, I may not feel great, but I can get up and do the things that I need to do. It's just not as enjoyable or pleasurable, but hey, I still can get it done. Well, the problem with that is that you have to remember, it's not just about how you subjectively feel. It's about the impact that that's having on the other tissues throughout the body. So in some of these examples I've been giving here, if they're allowed to play out long enough, thyroid cancer could be a consideration with that. Now, let's talk about a few functions on this. So I just alluded to this, and I want to give you more insight here into what are some things that we need to think about. And again, these are, just to reiterate, these are going to be linked to that T4 and T3 hormone, predominantly the T3, since that's our active. But we're going to be regulating the body's metabolic rate, and that includes the heart. Think about how fast or how slow the heart beats. If you think about the digestive function, think about whether the bowels are too fast, they're too slow. If they're too fast, then you're not going to allow that food that you've consumed to sit in the bowels long enough to efficiently extract all of the essential nutrients out of it. Or if it sits there too long, then that food may, over time, or that the contents of the bowel may putrefy. And so there's multiple ramifications from situations like that. When we think about muscle control, and in the situation where we talk about hypothyroidism, we can lose muscle control. Our brain speed, our brain development, our mood, any of these things that we might think about in the context of more of a neurological manifestation, those can be governed by thyroid, or are governed by thyroid as well. And then when you think about bone maintenance, we oftentimes hear, as especially in females, as we see an increase in age, you need to be cognizant about your osteoporosis or developing osteoporosis. Go out and do weight-bearing activity is typically the recommendation, and take calcium and maybe vitamin D. Well, what about the thyroid? There's a lot more to that conversation around osteoporosis than just those nutrients and exercise, and thyroid is a piece of that conversation as well. So bone is constantly turning over, and if we don't turn that bone over efficiently enough, then you're not going to have good, healthy bone. The skeletal system's not going to be good and healthy, and you're just going to have weak tissues there because that rate of recovery wasn't high enough. So these are some of the things that we want to think about as far as thyroid functions, and think about what it is that the thyroid gland is actually doing. Now, I told you I was going to come back to this term right here, metabolism and metabolic rate. And the way I want you to think about this is not just simply in the context of burning calories. That's far, far too limited. And quite frankly, the whole caloric conversation is a bit of a wasted conversation too, because your body's not sitting there counting how many calories you're taking in. It's not a bank account where we make deposits and have withdrawals. It just doesn't work that way. So think about metabolic rate as your body's efficiency. How efficiently is a specific tissue in your body carrying out its role? Let me give an example. When we talk about the liver or the kidneys, let me start with the liver. If we look at the liver, and the liver has multiple roles, and most of the time folks are going to think about this in a detoxification mindset. If we want to think about how efficiently the liver is processing toxins that we produce inherently, as well as those that we're exposed to from the outside, that is going to be driven by our metabolic rate. If we want to think about producing proteins in the body, so this is a role that the liver has as well. Those proteins, if the liver metabolic rate is not sufficient enough, we're not going to see a total production, a total quantity is not going to be sufficient enough to meet our overall needs. And so that can apply to whether it's the liver for detox and for protein production, as well as many other roles, whether we're talking about kidneys in terms of reabsorption of nutrients and minerals. We're talking about that for its detoxification role. Maybe we're talking about the spleen in recycling red blood cells. These can all be influenced by metabolic rate, and this is a far better understanding of overall metabolic rate. Now, in fairness, I know many people do still think about this as a fat burning concept, right? So there is an element to this, but you can't only think about it this way. But really how you should think about this when it comes to fat burning, or fat metabolism, better say, not fat burning, is you should think about it in terms of how efficiently is the fat that you're consuming as part of your diet, and or the fat that is on our body tissues, how efficiently can we take that fat, pull it into a cell, and burn it for energy? That is key for optimizing the output from many cells throughout the body, many different cell types, or in multiple different situations. We don't want to get into a situation where we're solely dependent on glucose all the time or sugars all the time. We want our body to be efficient at utilizing fat as an energy source too, and that's a better way of thinking about metabolic rate. Now, let me quickly talk about some of these other physiological effects here. I think these are often underappreciated. You'll notice that I've got an image here of a child. And so thyroid hormones are, even at a very young age, important for growth. When we talk about the development of the fetus and looking at brain development in utero, and even looking at brain development in the first couple of years of life, thyroid hormone has a significant impact there. If you think as adults and we're thinking about cardiovascular function, I've mentioned a few times here the rate of the heart. But when you also look at the blood flow through the vessels and the blood flow to other organs, and whether those blood vessels are dilated or whether those blood vessels are too constricted, that is in part governed by the thyroid hormone as well. We probably now, in this day and age, especially over the last 2 years, we have more appreciation for the impact that it could have on the immune system and also on mental health. When we look at those trends towards more depression or more anxiety, those are directly influenced by thyroid function as well. And I think any of us that are listening to this would all like to optimize our brain function. We would like to see our brains running at a peak level. And our thyroid hormone is part of what tells our cells in the brain, and of course throughout the rest of the body, but specific here, tells those cells in the nervous system, you need to fire at an efficient rate. And we need to make sure you have the energy precursors and you have them consistently to be able to facilitate that and carry that out. Now, what happens when things start to go awry? Well, let me share something with you here. And this is out of a peer-reviewed journal called Drugs. And so this is interesting. And I point that out because this is talking about the most commonly recommended intervention for thyroid dysfunction. And I want you to look at what this says. It says that over replacement of levothyroxine, which is Synthroid, all in that same line of thought there as far as medications, those are all really the same, is common. Over replacement is common in clinical practice and is associated with increased risk of atrial fibrillation, so fluttering of the heart, if you will, osteoporosis, and hence should be avoided. Interpreted in a realistic mindset, this means that I had a mentor, one of my instructors, had a real interesting saying about this. He said, you know, the thyroid is one of the most underdiagnosed tissues in the body. So when many people have hypothyroidism, it's not recognized as hypothyroidism. But in the same line of thought, it is also one of the conditions that is most overprescribed for, meaning that there is too quick of a reflexive action to go towards a medication like this when we have other options that we could pursue prior. Doesn't mean that these medications aren't necessary. So don't take that away from this conversation. It just means that even when these are in the conversation, when they have been implemented, we still need to look to further optimize the other cofactors, if you will, that can influence the thyroid simply because of what is stated here and trying to avoid some of these risks that are often deflected and minimized, but yet still exist. Now, what do we have to do to support a healthy thyroid? Well, appreciate that there are numerous natural, if you will, non-pharmacological strategies that we can take here to overall boost the thyroid and general health in the process. And I want you just to really appreciate that as I start to help you develop a different perspective about thyroid here. And I hope even up to this point, you've had a bit of a different thought process when you start to think about thyroid now. But now I'm going to share with you specifically what to get in and start to do about that on a daily basis. And when intervention is needed, what that intervention should at least in part maybe look like or start to at least be thought about. So reduce stress. Now, that's a bit of a generalized way of getting into this conversation. So what does that actually mean? Well, we all know, at least at this point, that while stress isn't going away, it's just part of how we all tend to live. I mean, even when we try to get away from stress, it seems to chase us down and grab us and pull us back in, right? And so we have to understand what the overall impact of that is. And so if you think in regards to this fight or flight, that's a bit of a better way of thinking about this. When we're in that fight or flight scenario, it taxes our hormonal and our nervous system. And if you'll recall back to that symphony analogy I used early on, when that symphony is disrupted, when any aspect of that symphony is disrupted, we're going to see impact elsewhere. And so let me give you a couple of scenarios of what happens when we talk about stress. And appreciate when I'm using stress, this image tends to point to an emotional stress, but this could also be a biochemical stress we're talking about. This could be a physical stress that we're talking about. It could be an injury. All of those are going to fall under this term. But ultimately, what's happening here at the level of the thyroid is that the brain becomes less efficient at telling the thyroid gland to adequately produce the right amount of thyroid hormone. In addition to that, the thyroid gland becomes less efficient at producing thyroid hormone. So now it's not getting the stimulus from the brain, but even when it does get that stimulus, it's less efficient at being able to follow through in its role of production of the hormone. But it doesn't end there. It continues on beyond that. And so remember, we have to take this inactive T4, if you will, and we have to convert it to an active T3. And wouldn't you know it, that stress has a negative effect on that as well. So it slows down that production of T4 to T3 to get us to that active form. And even when we get to the active form, that stress response can start to interfere with how that hormone is listened to at the cell. So meaning, does that hormone make it to the cell and actually have a response? That hormone might make it to the cell, but these hormonal activities that are a byproduct of stress disrupt that communication at the level of the cell. So stress is not something we want to overlook. But again, I'm talking generalized about this, but appreciate when we do that, we want to get more granular. We want to look at what the impact of that stress is, and we want to unravel that. Okay. Now, I won't belabor this point, but just understand that this influences it the very same way. So, I use this I just bring this to the conversation sometimes when I'm presenting, and I'll have someone tell me I'm a night owl. And that's not true. No one is a night owl. No one has a nocturnal circadian rhythm. Humans do not have nocturnal circadian rhythms. So when the sun goes down, within a reasonable amount of time after that, we should be looking to go to sleep. And same thing, when the sun comes back up, we should be rising and getting back up. So we have the effect of that rest or lack thereof. And the influence of light directly provides stimulation into our brain, which influences this hypothalamic pituitary region that we talked about. And if that plays out long enough, then that spills over into affecting the thyroid. Now, let me go one bit further. And this is one that doesn't tend to come to the top of the list, but you will appreciate this one. But if we overlook this one, this one is going to bite us, because these endocrine disruptors, and remember, endocrine is just a fancy word for hormone. These hormone disruptors are ubiquitous in our environment. You cannot run away from these things. Even, when you're making efforts to go out of your way to get away from them, somehow they always have a tendency to slip back in. Now, that being said, you can do a lot to control these and mitigate the impact that they have, but you really need to be aware of what they are and where they're at first. So let me give some context to this. So if you look at the group, the National Institute of Environmental Health Sciences, these guys have looked at endocrine disruptors, and what they define these as are chemicals that interfere with the body's endocrine system, with the hormonal system, and they produce adverse, whether it's developmental, whether we start talking about reproductive. Again, we can get into this conversation around immune function and neurological. Any of these systems and the impact that the hormone plays in that system becomes disrupted. And what's tragic about this is that we see this in humans. You see this in wildlife. And I honestly think that the impact that this has had on wildlife is far more problematic than even what we've seen in humans, because there's all kind of examples where we've seen feminization of male toad frogs. They've done these type of studies with chemicals known as atrazine. If you look at the genitalia in alligators, they've seen reduction in the size of the genitalia because of these endocrine disruptors. So there's numerous examples out there where these are causing a problem, but just understand that whether human or wildlife, these are mimicking and disrupting the hormones. And so if you start to look at what these are going to be things that you've probably heard about. You've probably heard things like bisphenol A. Sometimes we talk about that as BPA, or some of the pesticides and plasticizers. You may have heard the term phthalates. Even some of the pharmaceutical medications fall into this category. But these are going to be things that, when we talk about this lock and key mechanism, this receptor, hormone and receptor mechanism, if you will, where that hormone has to find its ideal receptor site, it has to lock up with it, and it has to initiate a response. These endocrine disruptors, they block that communication process. So think about going and trying to stick a key in a lock, and you can't get the key in there. It just won't go into the lock. That is essentially, if you're looking for a visual, that is what we're talking about. Now, it is absolutely critical in these situations to avoid exposure. And so just to give you a starting point of where to look, sometimes when I talk to patients, they tend to think, well, why are we talking about my cosmetics? And why are we talking about, the laundry detergent that I use? And this is part of the reason we have to have that conversation. It's not just about going in there and replacing thyroid. We've got to modify your environment, or otherwise we're going to be banging our head in a wall and not making a lot of headway. So if you start thinking about things like plastic bottles or metal food cans, and sometimes you'll see these, don't get caught off guard with this one. They'll say BPA free, but there's other plastics in the liner in there. So they may have taken the BPA out, but there's still other plastics in that. So just be aware of that. Your detergents, I mentioned, things like flame retardants. Sometimes when we look at mattresses are a big issue with this, or if we look at carpet, these types of things, they'll have these type of chemicals in them that will off gas, and they can be impacting and acting as endocrine disruptors. Two of the other ones that we tend to run into very often are going to be cosmetics and pesticides. And so, this is when I'll speak more about this momentarily, but this is where when we start to get into buying organic and eating clean food and knowing where your food comes from, this is the reason you have to do that. Because if you don't know, honestly, at this point in the game, you just have to assume that there's a problem. So enough said on that. Let's talk about the foods that support thyroid health. And I want to emphasize how significant it is to consume a diet that is rich in essential vitamins and minerals. Remember, these are not things that we have any mechanism in our body for production. At best, the bacteria, what we often talk about as the probiotics, at best, they can help us produce B vitamins and vitamin K and a few fatty acids. But when it comes to minerals, you're only getting those through diet or supplementation. And what's really unique about the minerals that have the greatest influence, or even the vitamins, some of the vitamins too, that have the greatest influence on thyroid function, let me share these with you and you'll see where I'm going with this. Selenium, iodine, zinc, iron, tyrosine, which makes up the backbone for the thyroid hormone, vitamin A, and vitamin D. Those are the nutrients that are going to optimize thyroid function. If we're going to talk about healing the thyroid and reducing inflammatory responses against the thyroid, then those are the nutrients that we need to think about. And so we hear this mantra of we need to fill our plate with more vegetables and load our plate down with vegetables as much as we can. And here's what I'm going to tell you about that. Selenium, zinc, and iron, good luck getting adequate amounts of those from vegetables. That's not going to happen. Same thing for vitamin A and vitamin D. Those aren't coming from vegetables. Now, let me be clear about this. I'm not demonizing vegetables, so don't run down that rabbit trail. But what I'm also pointing out to you is that when we hear everything should be plant-based, just the very essence of where these nutrients come from completely dismantles that argument. It has to be more of a balanced approach than that. So for example, when you look at rich vitamin A sources, we know that vitamin A is a fat-soluble nutrient. Vitamin D is a fat-soluble nutrient. And vitamin A and beta-carotene are different molecules. So taking in beta-carotene through plant-based foods is not going to be the same as taking in vitamin A. I don't have to make the argument for iron. Most of us can certainly appreciate iron and where that's coming from. And then if you start to think about, you hear sometimes we'll eat seaweed or eat Brazil nuts for the iodine and the selenium. They're okay options. They're not bad, but they're not ideal, and they're not as well-rounded as some of the animal products are going to be, especially when we start to talk about the ones that are more rich in these nutrients, the red meats that are more rich in these nutrients. And this is also, I shouldn't just pigeonhole this in the red meats, because some of the white meats that are appropriately raised, and even when we start to talk about eggs, let me give you the egg example. I think the egg example actually is probably the most compelling to this conversation we're having. And so if you look at one egg, it contains 20% of your daily recommended amount of selenium and 15% of your daily recommended value of iodine. So we don't tend to hear about eggs being a source of iodine, but guess what, guys? They are. And so we can start to think outside of the box and use these other food sources for the value that they have in trying to support the thyroid hormone. Now, I wanted to share with you on this just a couple of examples here, and you'll see the red meat and the chicken breast on this. And so if you look at that red meat is red for a reason. It's red because of hemoglobin, the blood. And what we know is that, and I'll use zinc as a great example on this. We've heard so much more conversation about zinc in the last 2 years as well because of the influence that has on the immune system. But when you look at zinc from an animal source, which is what's classified as a heme source of zinc, and you compare that against a non-heme source of zinc, the heme sources of zinc have significantly multifold increased bioavailability compared to the non-heme sources. So there is a difference there. Now, I'm pointing out the relevance in relationship to these nutrients that are key to the thyroid. And so one might ask with this, well, what do you do when those nutrients aren't as adequate in the environment? And I thought I would add a picture in here just to show you one of the things that we do, because this does happen. And here's how we make up that difference at our farm at Harvest Hills. So that image that you see on the screen right there, that is a mineral bin. And in each one of those bins is a specific mineral. And so our ruminant animals, our cattle, will come up to that bin, and based on what their need is at a time of the year or an environmental factor, a weather situation, they will use particular amounts of those minerals in the combination that they need to meet their metabolic need. And so that's how we make up that difference. Now, Why is that significant? And what does that translate to in regard to the thyroid? So let me delve a bit deeper with you here and help you appreciate the role that these minerals play. So let's talk about iron. Most of you, if I would have asked in coming to this conversation, what is iron good for? You would have told me fixing anemia, red blood cells. That is typically how we think about iron. And it's great for that. It definitely has a strong role there, but it's not its only role. And so we need to make sure that we have an adequate amount of iron, because as you can see, it may contribute to compromising the production of thyroid hormone, but we also have to store that thyroid hormone because we need to be able to release a specific amount when the brain tells us to release that amount. So when we talk about the synthesis, the storage, and the release of that is all driven by having adequate amounts of iron. And this is all irrespective of other minerals. You can see here that this is talking about iodine. So these nutrients are acting independent of these minerals, and they all have their own pronounced mechanisms of how they positively influence the thyroid. What about zinc? Well, before we jump off into zinc, I want every one of you to stop for a second here, and I want you to look at your fingernails. And I want you to ask yourself, do I see any white spots on my fingernails? That is what's known as leukonychia. And leukonychia is an indication of a zinc deficiency. That is your body's message back to you to say that I am not getting adequate amounts of zinc and I need food sources or maybe short-term supplementation that are going to fix this. And why is that so relevant in the context of the thyroid? Well, notice here that when we talk about a zinc deficiency, it affects multiple aspects of thyroid function. So it's going to impair how the hypothalamic area communicates with our pituitary, so that whole brain connection. It's also going to affect that communication between the brain and the gland directly. And remember, we have this lock and key mechanism that has to take place at these receptor sites. And if we don't have sufficient amounts of zinc, that all goes haywire as well. We can have adequate amounts of T3 to active thyroid hormone, but in the face of a zinc deficiency, you are not optimally utilizing that thyroid hormone. So we have to factor in what the role these nutrients are going to play as well. And so again, this leukonychia is a great indicator. And if that's something you see, you need to be thinking about, how am I going to improve my zinc status? Now, those are a couple of specific points about key nutrients. What about some other nutritional tips that I can share with you here to help you out as well? Well, we need to be cognizant about trying to plan with our diet. We know that if we don't plan, we don't put some forethought into our diet, that our diet tends to start controlling us and we make choices that aren't optimal. But we want to make sure that the choices that we're making are not inflammatory. That could drive us toward that thyroiditis that I talked about. We want to make sure that we're not exacerbating an allergic or sensitivity response here. Maybe there's something in our diet that our immune system doesn't care for, so that needs to be purged out. And one of the most prolifically talked about examples of this as it relates to thyroid health is going to be gluten. And so if there's any suspicion whatsoever about thyroid dysfunction, especially low function, that gluten needs to be taken out. And the reality of what we are probably looking at are the chemicals that are used in the conventional agriculture industry that are associated and laden in the gluten, in the wheat, that are also contributing to this as well. So now there actually is evidence for that that's playing out also. What else can I share with you here? So another one that I have is when we talk about blood sugar and making sure that we stabilize our blood sugar, eating at the right times of the day, eating what seems to be the right amount, not stuffing ourselves, not letting ourselves go too long or be hungry on and on and on and on and on. That's problematic as well. So we need to control that. And then also when we start to think about going back to this conversation around the endocrine disruptors and organic and clean food sources, we want to make sure that we're not consuming things that are stimulatory. We want to have those clean food sources. And also, I want to dispel something else in this as I'm sharing some of these strategies with you here. Of course, you want to go in and you want to eliminate the processed foods and the ultra processed foods. And I think that's interesting. Some of you may not have heard that terminology yet, but we have gone past processed foods. This is actually a very sad situation when you think about it. We are at a state now where we don't just have processed foods, we have ultra processed foods. Our bodies can't deal with processed foods. How in the world are they going to deal with ultra processed foods? So, and unfortunately, that's a lot of what we see when we go into the grocery store. We're told things like skip salt. Well, we need to be cognizant about what we're talking about there, because if we skip things like table salt, okay, I'll agree with that. But we need to be utilizing things like our unrefined sea salts. If you look in the grocery store, Redmond's is a brand that I really like. Those guys do a good job. I'll share something funny with you here. The salt that we use for our cattle, we actually source out of Kansas, out of ancient seabeds. That is the exact same salt that my wife and I use on our meals. So when I need to replenish our salt shaker, I just go out to the bags of salt that we use for the animals, and that's what I get it out of. And that's what we use on our food. It's an unrefined sea salt. Same thing. The point being here is that it is rich in minerals. And so it is another opportunity for us to increase the nutrient density in the food that we're consuming. Fats. I have to speak to the fats because this is going to influence these receptors. This lock and key mechanism can be influenced by these fats. And so we want to incorporate in good, healthy fats, things like grass-fed and finished beef tallow, grass-fed and finished butter. We want to have olive oil, pure olive oil. We want to make sure that it's a clean source and it's not adulterated. So we want to be cognizant about that. And those are what are going to optimize these receptors. So again, that lock and key, if we're looking to really make that functional, that's how we're going to do it. Now, let me share a couple of other things with you. Remember, I said that typical approaches to thyroid dysfunction always come back down to here's more levothyroxine or here's more Synthroid. That's the intervention strategy. And the reason that's the intervention strategy is because everything is read through the context of what is known as primary hypothyroidism. Reflect back. I said earlier, we were going to categorize these thyroid issues. So here's where we're going to do that. And so what you see here, and you'll notice this is coming out of Johns Hopkins, right? So fairly well-respected institution here. These guys aren't fly-by-night. They're cream of the crop. And so you'll notice on this that we also see that in addition to the primary hypothyroidism, we can have what's known as a central hypothyroidism. And this is also, it can be differentiated into both a secondary and a tertiary. So now we see a primary, a secondary, a tertiary, and these are issues with the brain. These are issues with the pituitary not yielding enough stimulation to the gland. This is not a thyroid gland issue, guys. And I will bet you if I did a calculation in my clinic of the number of patients that I deal with that are working with thyroid issues, but it is not a primary thyroid, I bet you 60% of the patients that I work with are a central hypothyroid issue. It is the brain is not efficiently communicating to the gland. And this can be byproducts of stress. This can be associated with these endocrine disruptors. It doesn't mean there's not other dysfunction there, but this absolutely has to be appreciated. So that's one piece that we have to look at. So here's an image that I have for you of the hypothalamic area and the pituitary feeding down to these different glands throughout the body. And you'll see on the right side, it has to feed down to the thyroid. So we have to make sure that these communication loops are in place and that they're working efficiently. Now, here's another issue that we can have. I alluded to this a bit earlier. We can have this underconversion. This is where we take that inactive T4 and we convert it to T3, the active form. So this is where the rubber meets the road at. And the liver, the kidneys, and the GI tract. So when we're talking about optimizing thyroid function, these are also 3 organ systems that also have to draw into that conversation and have to be considered. And last but not least is this thyroid hormone resistance. This is what I talk about with these receptors. This is your lock and key mechanism. We can see that there's an adequate amount of the thyroid hormone, but at the end of the day, it just isn't getting the job done because the cells are no longer listening to that. And this can be a byproduct, again, of hormones, other hormones, stress hormones, or it can be associated with nutrient deficiencies like zinc. So these are critical to optimizing the thyroid function. Now, let me just say a couple of quick words about a few things here. If we know exercise is good, and I'm going to be speaking in the future about different aspects of exercise and ways to personalize that for you and maximize the benefit. But in short, when we start to look at thyroid function and increasing metabolic activity, movement, not getting stuck behind the desk for hours on end, these are all things that play into that conversation as well. We also know that in these early stages of dysfunction, if you will, where we're trying to begin to work towards normalizing things, managing glucose and blood sugar and reducing some of these toxins like alcohol, these can all play into the conversations as well. So here's what I'm going to share with you guys. I've given you a lot of information here, and I want you to go back. I want you to start to look at some of this stuff for yourself. I want you to think differently. I want you to think more critically about thyroid. It's more complex than what we have been led to think about. And so we want to appreciate that. But I hope that this at least gave you a different way of thinking about options that you have in front of you as intervention strategies. So if a couple of points here to leave you with on this. If you're looking for more information, whether it's about hormones or some of the topics that we've talked about that influence hormones like nutrients, you can find more information on my website at drarlandhill.com. That's the information. There's a vlog on there that will show you a lot of this information that I've been alluding to. There's videos that you can tap into as well. If you are looking for or just trying to even better understand, you want more education about what I've been speaking about in relation to the food component here, go to harvesthillsranch.com and you can find out more information about that at our website there. And you made it, guys. We made it to the end. So congratulations. You got to the end of the webinar here. If you need a recap, I know I have dumped a lot of information on you, and I wanted you to feel like you got your time's worth. Your time was well spent. But if you need a recap on this stuff, this video this webinar has been recorded. It's going to go up on the YouTube channel, and I'm going to be emailing this out too. So look for the email of the replay on that. And I would ask each one of you, share this information with someone that you think can benefit from it. Don't hold it and harbor it to yourself. Get this information out there. That's what I'm doing for y'all. Hey, share it with somebody else out there. And as it relates to YouTube, I do want to say, if through listening to this tonight that you've come up with questions, go to that YouTube video when it gets posted and put those questions down in the comments section, and I'll answer those. And that way it'll get that information out there so other people can see that as well. So with that being said, guys, I'm going to conclude here tonight. Again, I want to thank all of you for being on with me, and make sure you look for the emails coming out that will make an announcement about what the webinar for next month is going to be about. And I hope to see you on that one as well. Have a good evening, everyone.